So what we're going to look at today is just how to set up for A3 and also linking it to your overall course objectives. Someone must have their microphone on, or it's my bad connection. So overall, the course had 3 learning objectives or outcomes. So I want you to do, and I'll do another quick poll of, do you think you've actually met them? And so we'll just do this as a thumbs up, thumbs down. I'll just get that. So you've got the ability to apply knowledge. So let's do a thumbs up, thumbs down of the objective 1. So have you found that you've been able to understand more about literature, strategies to search it, reading the research methodologies, understanding the research practices? So that'll be our first thumbs up, thumbs down of, do you think you've got the course learning outcome of number 1 down pat? So we've got 83 at positive and 38 negative. So then the next one, and so 2 and 3 is about summarizing. So that was sort of A2, and A3 is on the objective 3. So I'm going to do 2 more. So the second one is summarizing. Have you improved your ability to summarize articles? Do you sort of feel like you're sort of getting this ability to read through and start to understand what they're saying? Getting there, a little bit higher on this one. And so then the last poll, so we've got 19 participants and only 9 responses. So we need to get a few more responses into the polls so we can see. And then the last one will be about your ability to really work out whether the information is credible or not. And so I think you can keep voting even as I talk. So I'm just going to go to the next slide now. So think about the course learning outcomes and have you met them? So with the first one, this was this ability to find knowledge for practice. And so we talked in the first couple of tutorials about how to identify what you're looking at in a case study and the keywords, and then how to search and how to develop a PICO and a PO. So what is the difference between a PICO and a PO? Because this is important for A3. So in the chat, what is the article that I've put forward in for A3, do you need to use PICO or PO? PO, yeah, because there's no comparison, is there? There's no intervention in that study. It has just got a interest. The interest being health literacy, and our population being people who are Indigenous with chronic disease. So we learned also at that time to decide on search terms and how to use joining words and how to limit our studies and where to find databases. And we start to look at how to identify what studies were useful. So we were able to look at if they were literature reviews, which is secondary research, or if they were primary studies. So remembering we talked about all this. This was how to find knowledge. We then looked, and hopefully you're starting to become more than a novice, but an advanced beginner and maybe competent in this, the skills of summarizing articles. So we worked out how to use a framework to summarize them, how to understand what was within the article. And we talked about where parts of the article are presented. So the background, if you were going to use what is the background in in this in the articles? What information sits in the background? Morag's question, would there be primary or secondary outcomes in this article? So really, there are mainly primary outcomes because it really was an exploratory article. But if you were going to look at a secondary outcome, the secondary outcome would be to improve the person's ability to self-manage at home, because this was about how you improve their understanding of information. So the overall aim of the article was to work out how to improve that, but a longer term aim would be the fact that they actually were starting to understand and be able to self-manage. So article didn't talk about primary and secondary, but there was a sense that the secondary outcome would be this sense of understanding to be able to manage at home. Would you agree with that? The students that have read through that article, that if you can understand your education information better, then you can actually understand your ability to manage at home. So if you wanted to comment on that in that first 50 words of the sort of pulling together the information and summarizing it from the PICO or in the abstract, that would be something that you might sort of include, and you would justify it by using external references from the actual article, which talk about understanding health information improves outcomes in the long term. So remember, we talked about in this A3, the need to justify your answer. So that's where your secondary references would come from. Looking at other research, which has talked about the better you can understand health information and have it tailored to your cultural background, then the more likely you are to understand that. Yes, definitely, Morag. That's definitely right. The primary outcome is to improve health literacy and the understanding. Secondary is the longer term sort of understanding at home and being able to remember. Health literacy has three aspects: the ability to understand, the ability to sort of or the ability to find and understand, but then also the ability to actually action what you'll understand. And see, that's literally, if we're talking about literacy in relation to research, it's our outcomes that we just looked at. So we taught you the ability to understand. We've taught you to the ability to summarize, but we also are trying to teach you the ability to apply it, how to work and look at research to actually have it inform your ability as a clinician. So when you're summarizing, you need to know, and we talked also about reading that whole article, what are the highlights, where are the limitations, the abstract and the recommendations. So understanding where all those parts are and being able to then summarize that. And the ability to combine articles to develop recommendations which will inform your clinical practice, which is the idea of this course, is not just to teach you to understand research, but how you can have that inform your clinical practice. And then to be able to evaluate it, it helps you to really read and identify answers. So as you've gone through we talked about CHET, and you're able to read and look at different articles to then say, well, how can I best inform my answers to a particular case study? Now we've given you one article, and then how you might use that to inform your clinical practice. We've talked about sort of, you have in the course, we talked about, best research evidence, your research ability, but also then evidence-based practice is also about patient preferences, which is about, working with the patient to understand how to best tailor information and practice for them. So that's how we have gone from our learning objectives to hopefully something that you are now actually thinking about that you can do. So this last assessment item, it really is this critical evaluation. Now, remembering to constantly think about, it's not just a summary. This is your ability to critically evaluate. So you need to demonstrate to us that you don't just understand this article and be able to summarize it, but you can actually say what's good, bad, what's useful in this article to inform your ability to make recommendations for patients. And so that's what that last aspect is, to discuss the significant implications of research for contemporary nursing. So this is about your practice and your standards of practice. And so 1,500 words, but it's again broken down into smaller tasks. And so when we look at these tasks, use the template. So what I've been encouraging students to do is to really look at sort of the criteria and understand what you're meant to be doing, but then go back to that article and go through the process of looking at it and really understanding what is this article saying. You need to move past just reading the abstract. You need to read the depth and understand it, which is this process of reading to understand and being able to then write about in your own words. So that's our article. So one of the things that I've found that is most useful for both undergrad, postgrad, and PhD and my own research is sometimes you actually just need to print out the information, or if you're definitely a digital person, highlighting, because you need to highlight the different sections. So you start to pull out from this article the bits that are important for your actual assignment, and which is then informing your clinical practice. So, you know, complete each section of the table with notes and ideas. So as you're writing about the abstract or the methodology, what jumps out at you? How did they do this method? It was a concurrent mix method. So in your A3, if you just write, they used a concurrent mix method as a way to complete this research, are you going to get full marks? No, because all you've done there is summarized. We want you to critically analyze. So you need to be able to move from they completed a concurrent mix method to they used surveys about health literacy levels, which were completed with participants. At the same time, they also asked participants how they understood health information and how they then used that health information. This is called a concurrent mix method. Well, this study what used an overarching. So you've got your demonstration of that critical analysis, what they actually did. That helps us understand that you have on paper demonstrated your ability to understand what concurrent mix method means. So any questions as I'm sort of going through that process? And so as you're writing this report, so you've got your table completed with all your notes and ideas, and then you're writing your report, which needs to follow the framework. So I think the first thing you do in your Word doc is write out the headings so that you know where you're going, headings and the word count. Crystal's comment, why is it important to define, would it be important to define why it is used? Yes, because it's not that you're defining it, because defining is more like a summary, but you're justifying why this was important. That shows you that using a concurrent mix method, because if they just use surveys with an Indigenous population who have got poor health literacy, would that have been appropriate? And if you think that they didn't need the interviews, then how they did the interviews, was that appropriate? Use other research which justifies that, you know, being there with participants and asking them questions is the best way to get a clear answer. Yeah, exactly. If you just say it's a concurrent mixed method, you're not introducing you're not demonstrating your ability to actually critique. You're just demonstrating your ability to read And so that's where we're wanting that deeper level. So if I go to the next slide, if I can get my arrow to work. So that's I'm going to go back and forth a bit. So this is this ability to demonstrate your depth. So you guys are going into a whole lot of different parts in the assignment, which is good. But what I want you to remember is that the different parts are different parts, but make sure as you're going through that, you're demonstrating this concise writing with depth of understanding. So this is just 2 examples. So often students, and I've, this is my own writing where I've written quite a long sentence here about describing something. When you break that down, it could have been very concise. The same as in your A2, how, you were asked to describe what type of what sort of method it was. But when you just use the words, a systematic review of mixed method study was conducted, this could actually be reduced down, because as soon as you've said the word review, it means you're looking at across databases. Are databases strong? Does there need to be 5? No. And do you need to say including? Because that all is part of that information. All you needed to say is a systematic review conducted to compare the effectiveness of educational interventions for managing diabetic food highlighted, because it's the information that's important, not the process. So when you're talking about concurrent mixed method, it's the information of what did they do? Did they use, and off the top of my head, I can't actually remember if they used 1 survey or 2 survey, but that's the depth of understanding. Your comment there about what is important, but that's your ability to understand. And see, that's what you're just learning, what's important and what's not important. And so that's about reading more, because then as you read more about from other articles which are justification, that's when you learn about what's important and what's not. Because as you read more about literature reviews, basically everyone looks across databases. That's what they are. So that's not important. If you're looking at mixed method studies, what's important is what they did, why they did it, what surveys, what timing they used, and was it face-to-face or online. That's the important things, because when you look at studies and you read different types of studies, it's about how they've completed it. And then you've got to use your own knowledge. Okay, if you were talking to an Indigenous person and we know they have poor health literacy, sending them a survey in the mail, do you think it would be done or not? So this is where in this study, they were there with them. That's something that's important. That shows your understanding and your depth of critique, that this was a good way to complete this study by doing it face-to-face with the patients, knowing the fact that they've got poor health literacy. Your comment there, Chris, but it varies based on the type of study method used.
Sorry, just to clarify that further. So you were mentioning earlier about how when it comes to mixed method studies, you want to be explaining what kind of study was undertaken, who was involved, the timeline, that kind of thing. But would you then say that those studies or those methodologies change depending on, the information you're providing changes based on the kind of method you're using?
Yes, and it relates to the population you're studying.
All right, thank you.
And so that's where you use other articles which may have studied either the same population or followed the same process to justify that this was good or not good, So I have put a range of articles in the A2 readings, which will help you sort of justify the methodology. So making sure as you're going through that you're really getting more than just the summary. you're really looking at, so why did they do this? So if we go back to our little task description, so there is words. Now, this is not, there is an overall word count which must be adhered to. This word count gives you an idea that, and this relates to your criteria that we're marking from. So remembering that don't get sort of stuck writing too much on one area, because otherwise this is, it's really about you demonstrating your depth of understanding. I'm not sure if I've actually got the marking criteria in the thing. No, I do not. Oh, perfect point, Zoe. Now, Hazel was going to share with me there, you actually cannot abbreviate the First Nations people. That is apparently very inappropriate. And so have a look at, and I will send the link on the course, because we need to call them First Nations people. I noticed in the article that's what they use. They do not abbreviate it. So that's very important to think about. Headings are included in the word count. So you don't need to have, so the headings we've got on in this is, where are they? So you could just do, you know, the first heading could be PICO, then abstract, and then, you know, research design or methodology, sample, data collection, so that you can separate and make them smaller headings. And then, you know, you could do this as, you know, relevance, but it's not that the headings won't, you know, that's 10 words, so it's not going to be a big amount. And you do need, when you look at the criteria, you need to make sure you've got your references there. I might just pick up the criteria so we can have a look at that, of where the marks sit, because that's important when you're looking at your writing, to make sure that your information sits within the right areas for the marking criteria.
Could I just ask a question very quickly? Just some feedback that I found in my last assignment was just that when I was explaining, I was struggling to understand how much of the actual, how much to describe about the exact tools or the exact method that the data was, like, you know, the systems and that kind of thing that were used to analyze the data. And I was getting a little bit confused on how much I should include and how much I shouldn't include, because, you know, some of the articles they would have this really in-depth process of the kind of database that was used, the type of how it was broken up and how it was analyzed, who analyzed it, and the programs, like that kind of thing. I'm hoping I'm making sense. But I just want to know how much of that information is important to include.
The actual data analysis and sort of what they did is not that important. But what is your understanding. So what you can look at is, you know, I'm just picking up the criteria. So you can talk about, did they use a descriptive analysis? So that's what's important, not the actual process of what they looked at, but how they've actually identified what they're looking at. So not the actual analysis tests, but more the actual process of
So to clarify, it would be, instead of saying, you know, they used program name this, and this, it could be then just saying they used a sampling, or the way that they collected the data was done through this method, as yes. Like more talking about the method as opposed to the exact program that was used.
Yes, exactly.
Yeah, okay. Awesome. Thank you.
And so when you're looking at your criteria, it looks at accurately identify and explain the different elements of research process. And so this is so it's accurate identification and comprehensive explanation. So this is across that big table, worth 10 marks. And so as you're writing it up, you're putting in then sort of your examples with supporting references. So that's 10 marks. And then your evidence of that your critical and your comprehensive evaluation. So this is where you looked at that sample size and you say, so when you're talking about the sample, that you actually then identify that, yes, it was appropriate or not appropriate as per Smith and Jones qualitative sampling, so that you've got that justification. So that means that you've demonstrated that you know that with a survey, a sample size of this much is appropriate. With a qualitative interviews, sample size of this much is appropriate. Because a lot of times in A2, students said that the sample was very small, but it was qualitative. So it was okay that it was small. What they could have been saying is that the sample, the interview was a small number. However, they were able to obtain data saturations. Remember, we talked about in qualitative research, if you can obtain data saturation after 6-10 interviews, that's fine. If you haven't got that depth of data, then you need to keep doing more interviews. Where in a survey, in quantitative, you need to look at the sample overall, the population, and identify, is this a proportion of this overall population that would enable this information from this survey to be valid? Or is there percentage of the people that have done this survey not an example and representative of the overall population? Remember, we talked about if I was looking at stress levels for nursing student and I only interviewed, if I got a survey of the whole one tutorial, that wouldn't be appropriate. But if I got a sample across all years and nursing students, even if it was, say, we had 800 as our full population, if I only got 100 students to complete that survey, then that would be 10%, which would then be okay, but it may not still be representative. And so this is where your ability to critique looks at the number of people that have, completed or worked in these interviews or surveys and identifying them. Is the method, so the way they did it, was that appropriate to talk to Indigenous people? Did they have an Indigenous person doing the interviews, or was it the researcher? What was that relationship? Was there a power imbalance? That's your ability to read this article and critique it. So these are and then you use your justification as, yes, they did do this correctly, or no, they did not. Remembering it is your critique. So you can maybe bring up ideas that you found that maybe they should have done more interviews, or they could have used a bigger population, or they maybe doing the survey at the same time as the interview. Was there a sense of power? So did the people then who were doing the interviews, did they feel they had to be involved in the interview, but they may not have wanted to? Because remember, if you get asked and you're on the spot, sometimes you feel like you should do it. So was there a sense of power? Knowing, and your references to that may be that we know that Indigenous people are already a minority group. So was the researchers, was there a power imbalance? So that's sort of how you demonstrate. And because there's such a range in that article, each student will come up with different ideas. So we are expecting a whole range of different critiques in that, and as you're developing your critical and comprehensive evaluation of the research elements. You know, even the title. So you may sort of, as you're writing the bit about the title and abstract, was it clear and understandable? You know, you can comment about the tables, you know, were they clear? Like I feel that the tables were quite clear and easy to understand. I like the way they brought the quantitative and the qualitative together. But do you, as students and new beginning clinicians, did you find that that was interesting or useful to see? The criteria 3, again, worth another 10 marks, is insightful and comprehensive discussion about the examples, so that, you know, are you able to then bring that article and talk about it in relation to recommendations, implications of research for contemporary nursing practice and standards of care. So you might, so we know what standards of care are. We know we're meant to partner with consumers. We know that Indigenous people are minority groups. So, you know, when you're reading and understanding about this article, what are they talking about as recommendations? Could that be brought into clinical practice? And then the last 3 criteria are about your synthesis and integration of references to help provide, you know, support your justification, your evidence, and then your writing. So looking at that concise sentence writing and flow. So you're using that template to make it flow. So thinking about, you know, what joining words do you use? Don't use too many. Making sure that as you're going from talking about the abstract to then the background and the methodology, that it flows in your writing. And then the use of your literature. I'm just going to stop sharing that. And go back to my PowerPoint. Hopefully, week 10. Right, so now I can see the comments again. I couldn't see that. So Tanya, your comment, definitely, that is definitely worth a mention. So is that appropriate? Was it, you know, so they were given a $20 grocery voucher for participating. I think that would be worthwhile, but it's your critique. So you could look at other research working with Indigenous people. Did they provide a sort of participation tokens, or you know, what did they use? You know, I can't actually remember how they recruited, and so that's the information that you can provide in your essay. So I've sort of finished my slides. So what are the comments? How are you going with that ability for the concise writing? When you read this one, can you see how just, you know, 5 strong databases? There's no difference. That's what I call double descriptives. You don't need 5, you don't need strong. A database should be strong if you're using it. And if you're using databases, then you're expecting a number to be used. Can you see how you can move your writing from like a lot of writing to being quite concise? Data ethical clearance is under sample. But it doesn't, remember our actual marking criteria looks at your comprehensive explanation. So it doesn't actually matter exactly where you put it, because that's the criteria, is that general overall ability to bring out the bits of this research and to justify and critique it. And so let's have a look at the article. Yes, JJ, or I don't know how you pronounce your name. I'm very awful at name pronunciation. Definitely, I would feel that that would be a demonstrating your stronger understanding. One of the first things, I've talked to a lot of international students in relation to this article, and one of the things that was interesting was the article talks about yarning as their recommendation, which is, I've literally put the international students slightly at disadvantage because it is a very Australian and Australian Indigenous article. But just as a sort of when you read their relevance to clinical practice, they talk about yarning. What is your understanding of yarning? Let's have a couple of ideas, because if that's one of their sort of recommendations, yarning is found in other cultures, definitely. But what is yarning? Informal, relaxed conversation. Yep. Storytelling. Yeah. And so it's important to demonstrate your understanding of that particular when you're talking about the recommendations. Because they're last in their relevance by using yarning and plain language alongside visual aid is an effective educational technique to improve health literacy. So they are perfect things, and so use as you're talking about the recommendations in the last part of the criteria. Really bring other articles which talk about this way to respectively work with different cultures to improve their understanding. How do you find the research question for this article? I think it's either at the end of the background or the method. So in the aims, that's their research question. And I noticed that they have used First Nations throughout the whole article. They have not abbreviated at all. So because that would be seen to be inappropriate. So really do need to make sure that you're using that First Nations people throughout the whole assignment with no abbreviations. I will put a comment and the link to that on the course website. So yeah, so just to be very aware that we do need to have the correct terminology, because otherwise we would not be being culturally sensitive. And so they had 2 sites that they recruited from, one particularly in that Indigenous area, and one in the metropolitan area, so that you can talk about that they had sample across 2 different settings, which again adds strength to this article. And they had specific time of data collection. So in the bias, so that's where I'm just looking through. So who collected the data here? So I'm just reading in their actual, they've got the ethical considerations and the information about that. They had a Aboriginal health worker in the study. And so these were named as investigators. So again, that is reducing that bias, because they had, and that would be a good point to mention, that this builds strength, because these are Indigenous, the Aboriginal health workers were named and part of the study. But none of the authors identified as First Nations people. So they were included, but then they declined to be named. They'd rather be in that supportive role. So, so that helps that they definitely had that cultural reflection. I'm just trying to work out. So when you look at how they actually did the interviews, So they used yarning methodology. So again, look at, understand what that is, justify that that would be an appropriate way. So some of the literature cited in the article is older and now today. But remember, I said you can use, so if it's still, if it's the most current literature, and the thing is, there's not a lot of literature, published about health literacy and Indigenous people. So it is okay to then use that older literature, and I will make sure that our markers understand that. The main thing is you're not just using any old literature, that you're quite specific. And so you might then give it the heads up by saying, this seminal research done in relation to First Nations people talks about the best way to interview them is with storytelling, and looking at this and having interviews in settings which the people are comfortable with. Reference. So then you identify that this is how you are using this older literature to support that they did best practice. Does that make sense, Tanya? But I have, we do know that, and also a lot of the literature I've put in the readings are over 5 years, because you need to have, research evidence and justification are often older, because it's not like every 5 years someone does a new article about theoretical research. This is research that is being completed and demonstrates sort of this might be a good method, and so research to identify and justify that this methodology is appropriate is often older. Let's do a quick poll, because I'm enjoying polls. Hands up, and it'll just be a thumbs up, thumbs down. Who has read the article and is starting to really understand it? Is there any bias in this study? Is a question. Oh, where's my poll? Can you guys see the results? Yes, excellent. So most people have read and starting to understand the article. Yeah, and you do need to read it multiple times. Like every time I read it, I find a new bit of information. So the comment about bias. Now, bias normally relates to the researcher's position, remember? And I think they have identified the problem of bias by having two Aboriginal health workers in the study. So I think they've addressed that issue by the fact that they've actually used people in the study and the recruitment who didn't want to be named as First Nations, but they were Indigenous health workers. Yeah, that's Jolene. That's sort of why we did choose this article, because I felt that it's easy to read, but also hopefully useful for you as clinicians, because it's not necessarily that you may be working with Indigenous people, but it's really about understanding how to work with people that are non-English speaking or minority groups or cultural differences, that you really think about the way you provide care. And whether it's including the use of pictures, doing it as stories, being family inclusive, understanding who their family is, that's what's important by reading this article. So when you develop your recommendations, that's the sort of words that we want to see, that this article informs your clinical practice to be more culturally aware and deliver culturally safe care. So bias is just one part of the actual information. So remember, bias relates, I'm just looking at, bias is one part of understanding the research process. So it is not a definite, like, because they have addressed their bias in the ethics, you just need to say that they looked at, this would be your in your criteria 1, your accurate identification. So they had Indigenous health workers as part of the research team, helping to make sure that they didn't have a bias or a power imbalance. So bias is, remember, it talks about that sort of position of the researcher to the participants. Was there a sense of persuasion? They did have a use a voucher, but then I think that use of the voucher was more to thank them. And so you could talk about that. Researchers often thank their participants with something that would be useful in their, for their life, which is, whether it's parking. Often people will use parking vouchers. Others will use, a grocery voucher. It really identifies, that's a nice thank you to the people that participated in the study. So there's a whole section here about rigor and about the mixed methods, and improving the ability of this research to be translated. They had an audit trail, so you could mention for the qualitative aspect, they used validated surveys. So again, that identifies the strength of this mixed method research. They followed a framework. And so these are all things that you can mention in the strength of the research. So as you're putting the information about the research design, the sample, the data collection, they followed a good framework. They had a cultural advisor. They had audit trails. So this demonstrated their strength. And this, when you're writing this, it demonstrates your understanding of what makes strong research and what does not make strong research. Do we need to put in a limitation part? So remember, limitations is just part of the conclusions. And so limitations of what they said, or limitations of can be what you found. So the research, did they have limitations? They had acknowledgements, conflicts of interest. So their limitations are just embedded within their actual discussion. And so they don't mention major limitations. They had a comment here about the power differential in cultural safety. They had comments. So it's more about then understanding what they've commented on, because this particular research, it doesn't have a lot of limitations. They actually did a pretty good, research process, because when you're thinking about it, they had Indigenous people or First Nations people as their population, but they had cultural advisors. They looked at that cultural safety, cultural sensitivity. So you can actually, your comment, your critique is they actually followed a good research process with this population across these two settings. So remember, limitations are what you find and what the researchers identified. So the researchers haven't really identified major aspects as limitations. They've talked about their limitations very positively. So a mixed method, they've looked at their involved the First Nations people. They had a cultural advisor. So they've flipped their limitations to be very positive. Right. So last 10 minutes. So have you found this seminar was useful in just to help you break out that article? So I really want you to think about this process here, to print, or as you're looking at the article, highlight the different parts. You know, just go through and look at the different parts, fill in the table, because that helps you complete the sections. Remembering that our criteria is about accurate identification and comprehensive explanation of all the elements. So when you're going across those elements, you're going to have to really look at your concise writing. So maybe as you write it, go through and think about the fact of, have I used what's double descriptive? Have I brought in two of the same points across different areas? Make sure you get that concise writing. When our markers are reading, they're going to read your whole assignment, and then they're going to be doing the criteria, because it's not like the criteria is, have you done the PO? Have you done the abstract? The criteria is across the whole section, the same as it was for A2. So in the research design section, when talking about intervention, is that more talking about the methods used? So, because they didn't actually have an intervention, that they had, their design was to understand. It is an exploratory design. When you look at what they did, they did not do a health literacy intervention. They looked at how the people with chronic disease that were identified as First Nations actually understood health information. And so when they look at their findings, they found they had low health literacy. But then when you look at their qualitative information, it, you know, they talked about sort of using big words that they didn't understand. You know, they can't read. So how do we then improve our way to actually work with people from different cultural backgrounds? So they didn't, their intervention would be, if they actually then taught registered nurses, this would be like a second study, how to do yarning. So, you know, as students, you could, you know, look at and reflect yourself. How well do you provide information? That would be the intervention. So that your research design is the mixed method, the survey and the interviews, how they did them, and they how they then built those recommendations, how they combined that information. They combined it by looking at the surveys and the health literacy levels, and then what the people actually said about what made their health literacy and what helped them. And so when you look at, and so it may be also useful to have a look at what the health literacy questionnaire actually asked, and justify that. They used a good health literacy survey because it looks across how people actually understand health information, how they can action it, and how they actually then can interpret it. Because then you could use the reference about health literacy. And I think I can put that article on the team site about health literacy, how we break that down and how we can actually see health literacy in our patients, because that gives you that depth of understanding that what they did in this health literacy survey makes it very useful to understand how to provide recommendations for patients who have got poor health literacy. And they, you know, the way they integrated their qualitative and quantitative data. You know, it would have been interesting, and they don't actually do that. So they didn't actually, if they had done with their qualitative data, had the scores of the health literacy. They said the overall score, but, you know, would it have been more interesting if, you know, when they looked at sort of, you know, communication and Martha's, that's Paul's comment about half the time you don't end up understanding, what was his health literacy levels on the survey. But I think the surveys might have been de-identified. So, so that's another comment, were their surveys de-identified? Could they match them with the people that did the interviews? Would that have been helpful to understand? So did that make a difference on the health literacy levels with what the people were then connecting with? So that's your critique, remember? That's not from the article, that's from your personal critique of the article. That is you demonstrating critique and understanding. And so that's that last section in the actual marking criteria. So that's you saying, discuss the significance of the implication of the research for contemporary practice. So, would it be useful to do a health literacy assessment on individual patients, because you can tell from this article that made a difference on how they understood? That's your depth of understanding. So how can you put that together? So keep moving forward. In the team site over the next week, we will be monitoring that. So I've been answering students if they email me with questions. I normally just send an answer back with sort of comments in relation to that to give them the right direction. If you're struggling to find some articles about health literacy, we can put them up on the team site. If have a look at the readings in the resources. I put a whole lot of articles in the justification section, which are useful to sort of find about, how to do qualitative research, what mixed method research should look like. And these can be ones you can use to justify in your actual article, your actual essay. So simplify the headings, but leave them in. Start off with the full headings and the information so that you know what you're heading for. And then our markers will know to look at the different sections, remembering that the criteria has the 30 marks on your ability to pull that article apart and go through each section and accurately identify what it's saying. I might leave it there. That was a lot of information. It was recorded, and hopefully that recording has worked properly. And I will put some more information on your team site in relation to health literacy and Indigenous people, just so you can sort of get a sort of understand where to go. Thank you for linking in. And we do have another one this afternoon, which is good. So that will have the students that are on the day shift. Thanks. Don't forget to do my survey about the communication videos. I'll send that out again. If I use a minimum number of articles in the criteria, is it possible to mark down my side? No, if you've got the right number, that's fine. But remember, you can use more because often you don't want to sort of be using the same reference throughout the whole thing.